And I'm going to go ahead and share my slides. Fun. Okay. Yeah, so like I mentioned just a few minutes ago, I'm pretty excited about today's session because we're going to be talking about communicating the value of language access resources, language accessibility, just as a theme, and the legal basis of language accessibility to funders, to government leadership, and to just decision makers in general. So I know this is something we all had a lot of questions about before. So as always, please feel free to jump in and ask questions and make comments at any time. So, you know, the purpose of this is just that, like we talked about before, even when government leadership and funders and decision makers understand that language access is the right thing to do, that's not always enough to really compel them to take action. So in this workshop, we're going to focus on how to advocate effectively for language access commitments within these power structures that we all have to work and operate within. I'd love for you to share some of your own experiences, and we'll talk just about some basic communication strategies, some output and impact evaluation ideas for fundraising, and then facts and figures about the financial impact of deprioritizing language accessibility. So before we jump into the hard information, I would love to hear from some of you about your own experiences, right? So can you share just briefly, because we are limited to an hour, some summaries of what has worked for you and what has not worked for you? You know, have you tried to advocate for something like, for the example, maybe the creation of a language access coordinator position? Can you, talk about whether you've proposed a budget line for language services and been approved or denied? Have you had to convince decision makers or, for funding of the importance of these services? And if so, what worked and what didn't work? I'd love for us to be able to share some of those failures and successes. Let me see. How about, can I call on you, Brittany, just because I know you've had success in the past?
Yeah, so let's see. We had a water crisis back in 2014 in the city of Toledo that meant that our public water system was shut down for 3 days. And the city and the county that managed that crisis did a very poor job of language access. And so after that, this was something that was really important to the Latino community. And so they drafted a letter that basically put the mayors and the county commissioners on notice that they were failing in their need to provide language access. So they were legally non-compliant, if you will. And so that was one of the motivators to kind of start working on it. And let's see, what has not worked is, I don't know, it's been so hit or miss every time you try and advocate for a different, like with any department, we had some success with one department because they were secret shopped by the state and they failed their language access compliance. And so then I was able to, with the departments, to, do what I wanted for language access compliance. But then, that was one specific situation, so.
Yeah, and those are great, just short examples of how sometimes the fact that government can be so decentralized or is so decentralized can be a real problem. And sometimes, unfortunately, consequences are bigger motivators than doing the right thing or being preventative. And I also really like your first example because it talks about a community itself advocating for language access as opposed to being advocated on behalf of, right? Advocated for on behalf of by somebody within government. And I think that those strategies become really important because it's so messy and it's so decentralized. So
and just one additional quick thing is that they pulled that same trick out as soon as the coronavirus pandemic started. They waited a week. They said, we haven't seen any translations yet. And they sent that letter again. And it meant that I got pulled in quicker than I otherwise would have. So yeah, it's a really good strategy.
Yeah, and that's exactly the kind of stuff that we're going to talk about shortly is, you know, in an ideal world, people would act based on doing the right thing, but human beings are notoriously short-sighted when it comes to doing what's best for ourselves. And so we will often think in our immediate need as opposed to long-term, right? And so what that means, unfortunately, is that a lot of the times language access is an afterthought instead of a policy and a procedure, and that's what we want to change. And that's one thing that I really admire about the welcoming standard and about what Welcoming America does, because it's holding people accountable in a way that's sustainable. So if anybody else has one they'd like to share, a situation where you've had success or failure with getting a decision maker or a funder or a leader on board with language access, I would love to hear those. Okay, well, that's not a problem because this is a conversation, right? And one of the big steps in becoming an advocate for language accessibility and for successfully advocating for language accessibility is just identifying those hurdles, right? So maybe we haven't had successes and failures, so to speak, but one thing we can be proactive about is, you know, starting this conversation within the issue that language access just isn't on the radar for most people, or even if it is, its importance or function just aren't really understood. It's not malicious in many cases, it's just that most people, including decision makers and leaders and funders, just truly think that bilingual staff or volunteers or machine translation or having constituent English learners use family and friends as interpreters are all sufficient solutions, right? Like they just honestly think that Google Translate is fine, right? So it's not that they're being malicious, they just truly don't have all of the information. And in some cases for the decision makers, as I call them, or funders who don't understand both the importance and the best practices, doing the right thing isn't always enough, since financial resources are always being pulled in so many directions, and since unfortunately minorities are statistically underserved even without the added financial and logistical challenges that are associated with language access. So it's a complex issue, and the obstacles that I have here on this slide are just some of the most common, right? There are more. This is a systemic problem, and it's really important to keep that in mind when you're having these conversations. But you know, how can we begin to correct these misconceptions in a way that will resonate with decision makers, leaders, and funders? And how do we use data to tell a compelling story? How do we capture our own data to tell a compelling story that hits close to home because it's based on real people within our own real communities? How can we use positive language and real world data to avoid provoking defensiveness or shutting people down? I think that's all really important. And, you know, I think that some of the basic hurdles that I have here on the slide is just that, you know, it's not something that people think about. Language access is an afterthought. Language access doesn't have the same culture of enforcement that, you know, the Americans with Disabilities Act does, or fire codes do, for example. There are legitimate knowledge gaps. There are misunderstandings of the resources that are available to them. You know, people thinking that it's okay to Google Translate, you know, epilepsy medication information. Incorrect assumptions, such as it's okay to use family members as interpreters. Lack of funding, that's a really big one. Political will, etc. So, you know, keeping those in mind, you want to go into this fight or you want to go into this conversation with some strategies, right? And I want to make it clear that these strategies are my own opinions and things that have worked for me during my career. When I was a freelance interpreter for a bunch of social service providers here in my county in Pennsylvania, in the Pittsburgh area, I did mostly home visits with these social service providers, so I became a pretty fierce advocate for the families that I worked with, and I constantly volunteered to go with them as an interpreter during medical visits, for school meetings, evaluations, benefit applications, things like that. And while it was extremely fulfilling work, I sort of started to burn out after a few years, and I was pretty appalled that there were no real language supports for these families, despite the legal mandate and the obvious need, right? And then eventually I got mad, right? I was like, well, why am I doing all of this work as a freelance interpreter? Why aren't the hospitals taking on this responsibility? Why aren't, school districts providing this service? So basically at that time, I started yelling at people. I would just go into hospitals and I would make demands and I would yell at people and I would call people out and ask to speak to managers and like just generally loudly making myself known and making my agenda known, and it did not work. The only thing it did was to shut people down and to get nobody to answer my phone calls or return my emails, because that approach really alienated people, right? I was yelling at them and that caused people to shut down, which in retrospect is completely understandable. Nothing changed. I was not able to make any progress. I was just up on my soapbox, yelling alone, and it didn't do any good. So I spent a long time thinking about this, and eventually the reason I launched my organization, excuse me, was to try to solve some of those systemic problems with language access and language accessibility. And this is one of the big ones, right? The knowledge gap and the way we communicate with service providers. Excuse me again. So I kind of discovered throughout the course of my work that it really helps to set aside that kind of like righteous indignation or the righteous anger that I had, and really try to read the situation. Look at the people that I was yelling at, right? Like the nurse on Unit 4 or the manager at the branch of the bank I was at, or something like that, right? Like look at those people and try to think about it from their perspective. Right? It's a matter of most of them truly not understanding that Google Translate shouldn't just be used for everything. Most of them really think that they're being helpful if they let, a constituent's child interpret for them. Many of them have never been outside the country, right? Or in a situation where communication was a barrier. So they truly have no frame of reference. They have no baseline. And I have found that even though there is malice in some cases, and there is overt racism, and there is political opposition in some cases, that in my actual on-the-ground experience with actual people working within these institutions and establishments, more often than not, it's a knowledge gap and not an act of malice, right? And so meeting people where they are, I think really goes a long way. And I like to sort of let people know, anytime I'm doing a training for service providers about how to work with interpreters or about language accessibility, I like to let people know from the beginning that I'm not there to tell them that they're doing it wrong, right? I'm not there to shame anybody, and that they should not themselves feel shame. Excuse me, I had a little bit of karaoke happening yesterday with my daughters, and so my voice is a little bit hoarse. I really apologize. So like, I want to let people know in those situations that rather than shaming themselves or feeling like they're doing it wrong or shutting down because it feels so hard, that we should all just kind of acknowledge from the beginning that this is new to a lot of people. This is new to most people who don't do the kind of work that we all do. It's new to them and they're not sure if they're doing it right, and it's very hard. And I think acknowledging those fears and acknowledging people's efforts is really important, and just, starting the conversation by like, hey, you're not doing this wrong. We're all in this together. Let's learn together how to do it better, really goes a hard way. Rome wasn't built in a day, And I'd like to go back to the Americans with Disabilities Act example, wherein 30 years ago, when the ADA was new, we were all having these conversations around wheelchair accessibility and the importance of American Sign Language interpreters. So there is sort of a culture of accessibility around the Americans with Disabilities Act, and we're starting now to build that culture around Title VI, around Executive Order 13166, and around ACA Section 1557, right? And it's okay for people not to know the best way forward. 9 times out of 10, when I talk to lay people about language access, they will say that their biggest hurdle is that they just freeze because it feels so hard to them. And there are so many feelings of like, I'm doing it wrong, I'm failing, I'm gonna get in trouble, et cetera, around it. So just acknowledging that, you know, it's okay to be a beginner, and that's why it's so important to tackle this at an organizational level or at a governmental level. It is so important. And that's really a great way to pitch a language access coordinator role, by the way, because this is a person who can, you know, start where you are and remind people, you know, that they're here to help and to, you know, start the hard work of actually building the infrastructure. But, you know, overall, it's a great way to, you know, using positive language and approaching it in this way is a really great way to open the minds of decision makers and, you know, to open this conversation up without creating tension or like immediate resistance, right? And I'm guessing that all of us would be able to identify conversations we've had where people shut down around language access because it does feel so intimidating. But it's also important, you know, once you open up that conversation and you start talking to people about how important it is, but in a non-threatening way, once you have somebody's ear, once people are willing to work with you and to have this conversation, you know, it's really important to remember that even though they're open now to the conversation and they know it's the right thing to do and their hearts are in the right place, that's not always enough to move policy or secure funding, right? So you have to be strategic. And unfortunately, money is the main way for people to become motivated. It's the main motivator for most leaders. So any conversation with decision makers, leaders, or funders that you have to be supported by examples of financial costs that are incurred as a result of deprioritizing language access, right? So basically, it's expensive to get sued. It's expensive to solve problems reactively instead of preparing for them proactively, like Brittany brought up. And inequity in our communities affects everyone in our communities, not just those for whom language access matters most. And it's important to be able to communicate that using real data, which we're going to talk about in a minute also. So a good strategy is to kind of spend some time researching and creating your own bank of information about lawsuits that have occurred in your state, region, county, or city that have penalized service providers or governments, healthcare systems, school districts, et cetera, for a failure to provide language access per the legal requirements to do so. It's also important to define those legal requirements, so making sure that you have copies of Title VI, of ACA 1557, and EO 13166 on hand, so that you can actually send people physical examples, copies of the law, and just say, hey, you know, you might want to keep this in mind. Here are some examples, you know. In 2017, X hospital was sued for, you know, $42 million by the Latino Community Association for failing to provide interpreters. Having real examples is much better than just saying, you know, you could get sued, right? I know in our area, there have been 3 lawsuits that have really kind of scared people into providing language access services. And while I'm not happy that those lawsuits happened, you know, if lawsuits happen, that means that people have been hurt, and that's not what I want. And I don't want to commoditize that in order to, you know, have a means to an end. But I do think that ultimately the fight is to have a more accessible and equitable, you know, system in place, policies and procedures, and unfortunately, sometimes you do need to refer back to that information to be able to plead your case. So it's, you know, it's a good strategy to look at those, you know, lawsuits, but also try to record this information and kind of try to get to know it like your own backyard, just so that you can be able to reference those lawsuits, reference examples, even if there haven't been huge lawsuits, right? Like, have there been fines or citations or fees that have been paid? You know, keep a running list of those things, you know, maybe dating back the last 10 years, so that you have them on hand to reference during communications, to write into your proposals, etc. What were the actual financial costs of those, right? So we know that it's better to say X hospital was sued in 2017 for failure to provide interpretation. But what was the amount, right? What was the actual penalized amount? Because when people start to hear those numbers, I think it makes it more real for them, especially if they are, you know, people who are responsible for budgets and decision makers who pull the purse strings and things like that. How did these lawsuits benefit English learning communities? That's another important piece of information that you should have at your disposal, so that you're not just focusing on the financial cost and the burden of those lawsuits or citations or fines, but also the positive outcomes, right? Because you want to motivate people based on what works, but you also want to be able to paint a picture of what it looks like to have a more equitable region. Right, so if you have been able to, you know, target and define lawsuits, you know, what are the levels of exposure that the organizations you're working within face, right? How vulnerable is your target audience to those lawsuits, right? And what is their potential financial cost, right? So now we've said, hey, these lawsuits have happened. This is how much these lawsuits have cost other organizations. This is the positive effect that it's had in the community. And now here's where your real exposure is. And you should be careful, because I think you're in danger of potentially incurring some of these fines and lawsuits and fees because you have, you know, a blind spot in your technology, or because you only have Spanish interpreters, but you don't have Arabic and Swahili interpreters, right? So trying to know your audience and explaining to them how they are individually vulnerable to lawsuits, I think, is also a very powerful way to affect people's decision-making processes. So I do like to use the Americans with Disabilities Act here again, because we know that there is such a culture of enforcement surrounding accessibility compliance. So examples of this enforcement can serve as good foreshadowing for decision makers, for leaders and funders, because not only will they become more vulnerable as time moves forward themselves to these lawsuits, and to their level of vulnerability to citations, violations, and fines, but that vulnerability is sort of directly proportional to their level of preparedness, right, with their language access policies and procedures. And so what that's basically saying is, we know that, especially in smaller and mid-sized cities, the rates of growth within English learning communities are very high. I've seen some statistics as high as 80% growth. So in the next 10 years, definitely this is going to become a bigger and bigger problem. And so the more prepared they are to deal with this, the less vulnerable they are to these lawsuits, to incurring fines and fees. And not putting any preparations in place is almost certainly foreshadowing that there will be lawsuits and that there will be fines and citations in the future. One, because, you know, you're opening yourself up to more exposure the more people you have in a given demographic who are English learners. And two, I think that the English learning community, by and large, is discovering its power, right? Much in the same way that I think the disabled community and the deaf community have discovered their power and have become more able and more willing to advocate for themselves, right? And so these things together, I think, will create a much more fertile ground for lawsuits in the future. So really being able to overstate this and to talk to people about what the real risk is so important. And even at baseline, it's just a really basic economic principle that prevention is much less costly than damage control, right? No matter what your field. Preventative and routine healthcare, for example, that's a great example. We know that the rates of preventable illnesses such as STIs and things like cervical cancer, for which there are routine screenings and treatment, are much higher within minority communities and immigrant and refugee communities in particular. You know, the cost of retroactive treatment for those is orders of magnitude higher, right? If you look at cervical cancer, getting routine pap smears is a dime in the bucket of what it costs to treat cervical cancer, not to mention the human cost, right? So the cost of patients not receiving preventative health care, right? That's another example. They're much more likely to show up in emergency rooms in situations like this. And this raises healthcare costs around the country. It leads to poorer health outcomes, and this disproportionately affects minority communities, as we know, right? So this can also be applied to public safety, right? If members of a community feel unsafe engaging with first responders, police officers, public safety personnel, it affects us all as a community, and communities may become less safe, right? So we can see examples of this happening all across the board for pretty much any sector of any economy. That if you don't put the work in up front, the costs at the end of the day are going to be much higher for people. So, you know, this language appeals to policymakers, decision makers, funders, and it's important to sort of compile all of this information and become an expert. I say know it like your own backyard, right? Because this is ammunition that you're going to be able to use when you're trying to plead the case of having proactive language access policies. So the final kind of piece of this puzzle that I wanted to talk about is evaluating your own data to tell a story. And I was hoping that you all can share some of the techniques that you use, whether you are filling out an RFP or applying for policy changes or filling out grant proposals. You know, what are some of the ways that you all quantify the value of language service, right? Because you want to be able to actually show impact in numbers, right? For a lot of these decision makers, for a lot of funders. And so it's, you know, great to kind of compile and learn the human information inside and out, right? Like lawsuits, outcomes, situations, like the healthcare examples that I was just talking about. But the very best way to tell the story of your own community's needs is using real hard data from your own experiences, right? Basically, you have to be able to communicate the cost of deprioritizing language access using both general examples like the ones we just talked about, but also examples from your own communities that are accurate and that are recent. Talk to your stakeholders, right? Identify who the stakeholders are in your communities and ask them for anecdotes. Talk to people within the communities about the importance of language access. Have them share testimonials and examples with you and ask them for their permission to share those in your grant applications or with your superiors or with your decision makers so that you can paint that picture locally, right? So you can say, this is what's happening in our neighborhoods right now. These are the numbers, these are the real experiences that people are having, especially the financial data. So basically, you know, you want to be able to talk to your stakeholders, do things like track and interpretation usage. If you're not already doing that, try to go back and see, you know, how many times did we use interpreters for which languages, right? What story is that information telling? You want to actually evaluate that data. You want to compile it, you want to analyze it, and you want to store it so that you can use it year to year to track changes, to figure out, you know, where the needs are, who is in your communities, and how much money is needed to solve the problems, right? Using quantifiable statistics as much as possible, such as how many documents were translated into which languages, right? What are your up-to-date population statistics? That stuff's hard, right? Especially during this census year where everything's kind of a mess. I mean, I know within our communities, anytime I'm writing a grant, the only data we have is 10 years old. And there is some, you know, American survey data, and there's some hyperlocal data, but, you know, what are the sources and how accurate is it? And what story are we missing in those gaps? I think that that's a real challenge right now. Tracking interpreter usage and what your outputs are. And if possible, defining your outcomes, I think, is also a really good practice, right? So you can say to people, we need X amount of dollars because this is the proven economic effect that these policies and procedures can have within the communities we serve. So I'd like to just ask you for some more strategies, some more examples that, and some more successes and failures that you've had, especially with regard to trying to appeal for language access policies and procedures. But I would also love to hear how you're collecting and storing your data, right? And what ideas you have for the kind of data that would tell this story within your own communities. Because I think that you guys hearing from each other about this stuff can do a lot, because while I am an expert in language accessibility, you know, you guys are the boots on the ground who actually have the ability to make these changes within your local governments and within your organizations. So hearing from each other, I think, is really important. And then we'll do a brief Q&A. And I'll even start with, you know, an example of one of the, you know, I was mad, so I went into a hospital and just yelled at people kind of stories that I have from when I was younger. I think I was like maybe, oh gosh, this was almost 20 years ago, which is crazy to me now because in my mind I'm still 25. But I was helping a family that I knew from the community to make a dermatology appointment for their child because she had like horrible eczema and she just couldn't get through to make the appointment. I called and I made the appointment for them and I said, you know, they're going to need an interpreter. And, you know, the woman at the dermatologist just said, sorry, we don't do that. And I was like, well, you have to. And she was like, nope, they have to bring their own interpreter. And furthermore, if they don't bring their own interpreter, we won't see them. And I was like, oh, well, let me tell you. And I stood up on my soapbox and I yelled at this poor woman and, well, you know, poor woman, whatever. But I basically said, like, I want to talk to your superior. And she's like, well, that's just our policy. And I said, well, then I want to see where that policy is written. You know, where is this a written policy? Show it to me. And she wouldn't. And I kept pushing and nobody responded to me. And so eventually I found out that that woman got fired and that they did provide an interpreter. And my first instinct was to be like, yes, we won. But then my second instinct was like, man, somebody lost their job. That sucks. You know, how could I have had this conversation in a more productive way? And as like a 22-year-old, you know, there's no such thing. I just, you know, was all passion and idealism and I didn't learn a lot from it. But in retrospect, I could have handled that a lot better. And somebody lost a job. Ultimately, the family did get an interpreter, but, you know, I would have had, I think, much more luck if I would have been able to say to this woman, actually, these are what the law says. You know, here are some examples. Here is the number for your inclusion and diversity office. You know, please call them to qualify because the onus is not on us, it's on you. Right? I could have handled that much differently. So that's just like a story I have. It's a random anecdote, but I would love to hear what you guys can share with each other with regard to this, and especially with tricks and tips for evaluating data that you guys have come across.
So if I can jump in, this is Brittany. So I have actually had a really hard time using some of these tactics in isolation of other tactics. So for instance, just telling my government peers about their, you know, their risk aversion that they would save, that this it's cheaper, it's more cost effective, if you will, to invest in this now versus getting sued down the road. I get the response oftentimes, well, government has a whole bunch of unfunded mandates, we can't do everything, or you know, like, so unless they see why it's a priority right now, that's a really good educational tool, but it hasn't been as effective in getting them to move the needle. So, so that argument, I think, in combination with, you know, pressure from the community, elected officials don't like to lose face. So, yeah. You know, or having external organizations push in, you know, in advocacy spaces or potentially threatening lawsuits, kind of that inside outside game, because it can be very problematic for me as an inside government worker as well sometimes to push from the inside, because, you know, my bosses don't want to hear about unfunded mandates. So so anyway, so that's some of the things that I found. It's also being a constant resource for people to you know, like, I will show you how to do this work, or I will, you know, help you develop a plan. So, but that does take a lot of my own capacity as well. And so that, you know, kind of can be a rub. So.
Yeah, and I think that's really, to me, advocating for an appointed language access coordinator is kind of my number one, like, let's get this done within local government, because that is often the most cost-effective way for somebody to kind of take this on, right? Because being that person, and this is what kind of triggered my response to what you said, Brittany, you're like, you know, making myself available to help, right? Having that person officially on the books can actually protect against lawsuits a lot of the time, because you can show in good faith that you are making reasonable requests. I mean, you don't want to discourage people from actually then creating the policies and procedures by saying that, but having somebody on your payroll is a relatively small amount of money for a government to kind of pony up to be able to have somebody help with questions coming from other parts of government, to put solutions in place, to come up with a real budget and things like that, rather than that whole decentralized, like, well, let's everybody ask Brittany, right? Or let's ask, oh, the person, you know, from, you know, public health who knows about this stuff. It's a place to start that I think is one of the most successful cells, right? But not always. So has anyone else had experience with trying to get a language access coordinator in place?
So this is Karen, not specifically around that, but to your first question about issues that we have around language access, just a couple things to highlight that we've seen here that we've had to deal with. Our Michigan State Police, if they would pull someone over who did not speak English, and whatever Michigan State police officer pulled them over didn't happen to speak the language either, their immediate, like their first line of defense, so to speak, was to put out a notice or call to the local CBP and ICE officers in the area to see if someone could come respond to the traffic stop. And so we immediately had to work with Michigan State Police to say, no,
yeah, that's
not appropriate. Let's use that language line or whatever it might be that we have, you know, linguistica, whatever it's called. Let's use that. And we also often hear, well, anecdotally hear of both our local health and human service offices as well as our local Michigan Works offices asking, for example, with our refugees, they're asking the refugee resettlement agencies to be the interpreter for their clients. And so again, there's just so much educating going on. And to be honest, I mean, I'm surprised we haven't been sued more, being very honest. And I wonder if that's part of what it would take, you know, to get people to really pay attention. And the odd thing to me is we have some of those resources. Like a number of our departments have a contract with something like Language Line, whether it's that or not, but their staff doesn't necessarily, either doesn't know it or just doesn't want to take the time to use it.
Mm-hmm.
Yeah, and that's one of the biggest, you know, when I talk about a lot of these problems being systemic, I think one of the biggest systemic problems with language accessibility is people just don't know how to language access, right? So people might have the right, you know, ideas, and they might have their hearts in the right place, but unless they actually know how to call Seracom and enter their PIN, you know, those resources are useless, right? So training is a huge part of it. And even if there's not the political will to, you know, put a budget line in right away for language access, you know, surely a training. You might even be able to convince some not volunteers, but some of your local language service providers to do trainings. So like, I know we do trainings all the time to teach people. It's like language access 101, right? This is the difference between telephonic, OPI, VRI, in person. This is why that's important. This is the difference between translation, interpretation. Here's how to work with interpreters. And even just doing those trainings with, you know, one organization and then another organization, you know, it starts to like build that culture of language accessibility. So if you can get buy-in to either have a local language service provider train staff within your police forces, for example. We've trained a lot of police, and they are super resistant to all of the ideas. But if you do that positive communication and you really meet them on their level and understand that, you know, these are people who have never traveled outside of the United States. And in some cases, like I'm generalizing here, but, you know, there's no baseline for them, and try to break down that defensiveness and open them up to using the resources that we have by telling them, you know, it's so much easier if you just learn how to use the blue phone, right? Or if you just learn how to use language line, or if you just, you know, learn how to train your Spanish speaking staff how to interpret correctly, right? If you can have those conversations successfully, I think it's much more likely that you can start to build that culture that eventually you can leverage to actually get the budget line, right? That you can, you know, show these have been our successes, and this is what the outcomes are, you know, based on those successes. All right, well, we are up to our Q&A portion, and I want to remind people that the Q&A doesn't have to be just about today's content, right? I think that these workshops are a really great opportunity because we have so many people together who have such different experiences to ask each other and to talk within ourselves about just our experiences with language access across the board, right? So please do ask me any questions you have about today's content. I see there's a question in the chat. And Karen, your question is, what's the best way to search for those lawsuits? The answer to that is that I'm not really sure what the answer would be in each of your individual communities. But here, I just talk to stakeholders and ask people and Google, and, you know, especially within some of the relationships I've made within our hospital systems and education systems, they're happy to share that information. In some cases, you know, a simple Google search will turn up tons of stuff. One of the big school districts in our region had a rather large lawsuit a few years ago, and that whenever I Googled translator lawsuit, Pittsburgh popped right up. So it's just like anything else. It might require some research and some digging, but I think it's a really important step just to kind of have that information in your toolbox for when you have these conversations. But so that's a really great question about, you know, this conversation, and I welcome more. We've got about 15 minutes left. And if you guys don't have questions about today's specific stuff, then anything at all, really, I'm here to answer and to guide as best as I can.
Mary Jane, this is Sabine calling from Louisville. And I had a question really around, I know we've been talking about training with language accessibility. And, you know, we were just talking about the police departments and just different departments and getting them trained in the various language accessibility pieces out there. You know, and I strongly feel that it's not just about the language accessibility piece, but it's also about some cultural competency training that needs to go hand in hand with this. You know, we know from our foreign-born various cultures come off and have different, you know, cultural ways of acceptance and the way you talk to them and eye contact and so forth. So I'm curious as to whether you or anybody else on this call has had that experience with that training, and how and what does that look like, and if they'd be willing to share some resources around, again, not just language accessibility, but around that cultural competency piece when it comes to international communities.
Hi, Sabine. This is Emily and Charlotte.
Hi, Emily.
So I have a bunch of questions. Love Louisville. But what I had that same thought. It was like, how do you offer those cultural competency opportunities? And the one thing that I've learned, because we usually do one thing internally every year during welcoming week that's around cultural competency, and I can tell you which city employees are going to show up. I know them. We hang out a lot. They're my friends, and they're interested. So they enjoy the conversation, but they're not necessarily the ones who need it. And so I was really trying to search for a way of how do we get other people to join in. And I got an idea from YouTube, actually. Vanity Fair used to do these videos. I can't remember, I think it's called Slang School. And so it was celebrities would come on and talk about the slang from their like country that they're from or from the state that they're from. And so it was really interesting when you got even into just like between the different states inside the US. And so I switched that on its head and did it for from a language access perspective. And so I had, I think it was 5 people volunteer to do it during a departmental meeting. And 3 of them, it was for English. And so they were sharing you know, like Southern slang. And for the other ones, it was different languages. 3 people from 3 different Spanish-speaking countries. And so it was this really neat learning opportunity to talk about how it's hard for English speakers to understand English speakers sometimes. There's terms that we share that we don't understand from each other. It's like, then there's that gap when it comes from, you know, when you're learning a new language. And then even just this understanding, especially with the 3 Spanish speakers, of there's such, like, there was such different cultures, of course, between these different countries, and kind of bringing that to mind. And then it turned into this discussion that was in its essence about, you know, thoughts around cultural competency, but it wasn't announcing it at all. I you know, put it out there as a sort of like fun, interactive, welcoming week activity, left it really open to interpretation. But then the people that did show up, they had this component added into their day that they weren't necessarily expecting. And some people may not have gone had they known what the intention around the discussion was.
Right, right. That's really cool. I love that.
That's really cool. I wrote it down while you were talking. And this is a really good question too, because it's this whole like weird boundary where, like, yes, language interpreters can help people navigate cultural constructs and can be there for that purpose, but we're also not cultural competence trainers in and of ourselves. And so, like, where is that boundary and where do the roles overlap? And one thing I've found is that many organizations have to do cultural competency training and have budgets for it. And they do it once a year, and they love having language access be one of those like specific trainings. And in my experience, the service providers who were like on board and who were interested, like, I loved, Emily, that you said, you know, I know who's going to be there, I know who's going to show up, right? It's always the same people, but like, you know, just putting those trainings out there, you know who you're going to get, and then trying to find creative ways to engage people who maybe wouldn't otherwise show up, I think is important too. But I will say that I've had great success with very minimal outreach getting people to show up, because I think that a lot of people are interested in this stuff and they just don't really know where to start, or they don't know that they need it until you kind of tell them that they need it or offer the training. And that doesn't really answer your question about how to address the cultural competence through the lens of language access, but I think that there's a huge missed opportunity for more organizations to do a language access training as part of their annual, you know, mandatory cultural competence training, and that can be paid, so you can, you know, actually get decent trainers out there and have some money to play with to promote it and things like that.
When I work with our departments, to develop their language access plans, I make it a part of that they have to both have language access trainings, but also cultural competency trainings. We've also partnered with, we have a regional, like our community foundation has a Center for Nonprofit Resources. We partnered with them on their cultural competency trainings for many years. And they asked us, okay, we've done this for a couple of years now, what's our next step? And we said, can we pair the content with language access? And so we did that. And that was more for a nonprofit audience, which is a little bit different than government. Because our mandates are a little bit different. And then we also asked our vendor to not only do a training on how to use the system effectively, but also how to serve LEP clients. And so I think that kind of gets a little bit to that cultural competency piece of working with English learner clients or LEP clients. And so, but we also make sure that and then I also tend to have to explain to people what's the difference between cultural competency trainings and diversity trainings, that they're different, you know, that, you know, attending a training about the Latino community for one is potentially problematic, but, you know, two is different than like a cultural competency training. So that they're both equally good, but they're different. So.
Yeah, Brittany, that you're so right. And especially with diversity, you know, I often come across folks who feel like diversity is really, you know, addressing the color of your skin. And it's just, you know, it's African-American, Caucasian, because those are the predominant cultures and so, or races. And so therefore we're being diverse, but there's just so much more when it comes to international communities that people just don't realize. And I think it goes to Mary Jane's point earlier that, you know, there is just some sense of, well, I don't know what I don't know. And so they just don't know how to address it. And they just don't know how to, unless me, I'm in their face about it. Like, wait, what about this? And have you been intentionally inclusive about this? And have you thought about that? And I know, Brittany, you're doing a lot of that too. So yeah, thank you. Thanks for sharing.
Yeah, and there's one more, we're almost out of time, but there's a question in the comments or in the chat about, you know, what are some good recommendations for collecting and tracking language needs and use data? One thing that I would say is, you know, I always stress over and over the importance of building relationships with your local language access provider, or your language service providers. Even if you're not able to pay them for services, or they're, you know, let's say your city has a contract with the lowest bidder, because that happens a lot. But then you have this great, you know, refugee resettlement agency that's providing interpretation, or a nonprofit language service provider. You know, building relationships with them can be really important. And I know, like, we track every single appointment that we have, the zip code that it's in, and we can share that with people as long as we're not including personally identifiable information. So we've actually partnered with our state's health literacy foundation and a sort of data mapping organization at Carnegie Mellon University to actually put that data to work. And you'd be surprised, because most language service providers will have that information, you know, like, you know, in the last 6 months, we've had 213 requests for Vietnamese in the 15218 zip code, right? I just made that up, so it's not real. But if you can partner with a provider like that to track the data, that's another really good way to do it. And a lot of it too can come from hospitals. A lot of it is required to be public information if it's coming from anything that's been compiled by governments or nonprofits, for example, anything that's publicly funded. So identifying sources and also tracking your own are good places to start. All right, well, thank you guys so much for another really awesome hour. I really love having all of your input because I think it's so important for everybody to hear from each other, and for us to be able to come together in this way is great. So thank you to Welcoming America for making it happen. I do have both of my one-on-one sessions for this Thursday are open if anybody wants to hop onto one of those to talk about a specific thing or troubleshoot resources or try to nail down some more evaluation techniques and things like that. Please feel free to jump on that calendar. And otherwise, I'm looking forward to seeing everybody next week if nobody has any other questions.
Thank you.
Yeah, thank you guys so much. And
Thank you.
I hope you had a nice Memorial Day. Sure. All right, take care, everyone.